Welcome to the Prime Health Podcast with your host, Dr. Derek Barron. Dr. Barron interviews doctors, wellness experts, and healthcare leaders who are revolutionizing how we approach health and longevity. The Prime Health Podcast explores breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. So sit back, listen in, and prepare to transform how you think about your path towards Prime Health with Dr. Barron and his special guest.
Hello, my name is Dr. Derek Barron, and welcome to another amazing episode of the Prime Health Podcast. We interview doctors, nurses, wellness experts, and healthcare leaders who are revolutionizing how we approach health and longevity. We explore breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. Now, before we get into today's episode and our amazing guest, a quick note from our sponsor, Grow Solutions, your business growth partner for busy health and wellness professionals. Now, if you have issues in your practice that kind of slow you down, we try and eliminate those big headaches, whether it's new patient lead generation or improving patient communication, operations, processes, systems, frameworks, and yes, especially AI, which is in the picture. If you're having any of those issues, we'd love to be able to help. We are not just a vendor, we are a partner in growth with your business. So if you have ever said this to yourself, I'm too busy to grow, too slow to scale, or too overwhelmed to fix it, we can help. Just drop the word growth in below. Myself or my team will reach out to you, or you're welcome to reach out to me in any social media link that you see below. But let's get into our special guest today. That's the spotlight that we have here. And I'm pleased to introduce you to Deidre Arms, a board-certified advanced practice nurse and leading expert in integrative and functional medicine. Deidre is the founder and director of Aspire Wellness Integrative Health, where she specializes in hormone health, gut restoration, and root cause approaches to chronic conditions. With over 20 years in medicine and nearly a decade focused on integrative and functional care, she has built a reputation for helping patients transform their health when conventional approaches fall short. That happens way too often. So I'm glad to hear that. Deidre has helped hundreds of patients rebalance hormones, improve fertility, help digestive issues, and reverse patterns of inflammation, allowing them to regain energy, confidence, and longevity. She is also a national speaker, educator, and YouTube host committed to empowering both patients and providers with evidence-based, whole person strategies for lasting wellness. Deidre, welcome to the Prime Health Podcast.
Thank you, Derek, for having me. I'm looking forward to this conversation today.
Absolutely. I'm looking forward to as well. And we mentioned a little bit before here for the call, temperatures have dropped in your area. If you need to grab that warm tea for a little sip, please do. No problem there at all. So as we start this off, I always want to know, what was the potential catalyst that got you into medicine?
Into medicine, really, I was at the time a mother already and had started doing home care, and my actually son at the time would take me, and that's when I started learning more about chronic conditions and everything, and just really wanted to dive into that. And it was like that gradual process where you learn a little here, you work in a doctor's office, you start to do this, and you start to get your degrees. My first degree was in business, so was not at all in healthcare, but obviously you can use a lot of the business aspect for healthcare as well. But it was just those little things of being exposed to people. And then I have my own kind of personal story later that kind of changed my trajectory to integrative medicine.
So you were business first, and then you went into medicine. Did you start in nursing right away?
I started in nursing first. So I got my bachelor's in nursing, started out in labor and delivery. So women's health arena there. And then from there, I started teaching at university here in Ohio, and then a couple other along the way. And for 19 years, I was with one institution, and this is my first fall not being with them. It's kind of like really odd.
Well, that's good. So from the transition from being the nurse and then being into labor care that you dealt with that, then what kind of got you in that towards the integrative approach?
So in the integrative approach. When I started my nurse practitioner and I was doing that, I knew I wanted to be back in women's healthcare because I really enjoyed that as a labor and delivery nurse. And in nursing, we are taught a holistic way to do things, like, especially in labor and delivery, there's very few meds we can give a mom, very few things that we give babies. So we were already thinking of alternative things that we can do for comfort and for ease, breastfeeding, all of that. So that kind of started my knowledge into things. And then I had the opportunity to work with a provider who had done some like integrative functional medicine in their practice. And I loved it. I loved it so much and just dove into it from there. Probably watching way too many webinars and podcasts than I should have, to really dig deep, and then found myself just engaging more and more.
Yeah. Okay. Well, I'm sure your patients thank you for doing that. That's probably a pleasure that you've worked so hard on it, and it's good that you're in it. What are some of the misconceptions that you still see that are out there about integrative care?
Well, I think a lot of people think that maybe integrative care actually isn't normal care, or maybe it's not evidence-based. So that's the big thing I get from providers, is maybe that it's not evidence-based, but that's so not true. There's so much evidence to point us to how the body heals. And that's the biggest misconception that I see.
And the reason again behind you being a nurse and delivery, like would you say a majority of your patient clientele currently is the female side?
About 96% of who we see they are female. Okay. But I'm just going to say this in families. Women drive healthcare for their families. Absolutely. So even though we have a high majority of females, we do see male, do see children. However, we know if the mom is well or the female's well, she's going to promote that to her whole family, and it's going to trickle down.
From the business side of it, I know that when myself being a chiropractor, when we were starting in our training there, I was like, if you really want to build a family practice, work with moms, because then you'll bring in their kids and then they'll hopefully bring in the husband, versus if you start with the husband, you may not get the wife and you may not get the kids. So you're exactly right on how the women control that. So what types of conditions do you most commonly see that come into Aspire Wellness?
So we see a lot of people for hormonal imbalances. That's such a huge thing. Menopause, perimenopause, PCOS, endometriosis, infertility, gut health, weight loss, thyroid, those chronic conditions. Those are probably the driver of a lot of what we see here at Aspire Wellness.
Okay. And then let's just say, so when you were at this previous business for, I think you said 18 years, what's different in the approach with Aspire Wellness, how you will treat those patients versus maybe how you were in this previous business?
So in a traditional model of healthcare, most of us know our time is very slotted. Like, it feels like a production line. Yeah. I would maybe have 10 minutes with a woman to do an annual exam and to hit the highlights of what I was supposed to, and then walk out and document. So my volume although high, and you produce it just feels like a production line. So what we do at Aspire is we make sure that you are heard here. So it starts with the first call. When you do a discovery call, you feel heard. You have a chance to talk to somebody, and all of our appointments, whether you need it or not, are always scheduled for an hour, because we don't want to rush you through that. We do not double book or overbook. We have health coaches, holistic practitioners, nurse practitioners. So we have an array of people here in your corner, ready to be part of your care and help you through that.
I love to hear that. It is a conveyor belt of patients, typically in typical healthcare that's out there. I'm glad that you stepped away from that. So if you, in the last year, just as the fall season approaches, you started this, so there must have been some big additions to your team in a short period of time to create what Aspire Wellness is with all of the providers there. Is that correct?
It was just a huge godsend is all I can say. I cannot take credit for this, but we just really exploded. Yeah. in a very short period of time. I think it's just the timing of being in the right place at the right time and having the right message for people. And word of mouth, we haven't even really done a lot of advertising. It's word of mouth with our practitioners. And because I was in higher education for so long, and I had the opportunity to precept a lot of nurse practitioner students, so they started learning what I was doing. And that's how I've gotten connected with so many people who wanted to be part of our team here. Two of our practitioners, actually three, were former students of mine.
Oh.
Yeah. And then one, I was a former student of hers. And then another, we worked with each other. So it's like this whole, everybody not only is in this nurse practitioner role, but all of them at some point are doing higher education and making sure, like teaching the next generation of people as well.
That's good. So you not only see clinical time, but you also do education of private practitioners?
I do. Yeah. We precept nurse practitioners, physician assistants. If they reach out to us and we have availability, we'll do that. And over the years, I have thousands of hours of precepting under my belt and like helping students and teaching them. And it's something that I find really rewarding because I have to know this stuff to be able to recite it and teach it. So
Right.
like it's very helpful. And I think it's really helpful for other practitioners to see this side of things. So that's why I love to share our practice with other people, because they're going to see the assembly line thing and then they're going to see this too. But when you're able to see both sides of it, you can see where you want to practice later, like how you are going to be as a practitioner.
Right. That's a great point. So they may make a decision. They go on the assembly line, go at the hospital or a clinic. They come to view what happens at your practice, and then they can make that decision. Which one do I want to go into? And I think more people, would you say, are comfortable with the initial, because that's just what we're aware of. We don't know that there's practices like yours that are out there.
Right. I do think, because as a nurse, when I worked in the hospital, that's all I knew is like a medication for this. And this was the way that we did it. And so when you start to learn more holistic approaches, integrative approaches, and you start to see people heal, like I get to witness healing every week here, and that's amazing.
Yeah.
And I think when people see that, and we have one person precepting with me right now, and she said she had lost her like hope for medicine until she started coming here and realized like the body can be healed and can restore even if it's a complicated case. And so when you give that hope back, maybe they still will be in that traditional model, but there'll be pieces of it that they can carry with them.
Yeah. I love to hear that, unfortunately, but I love to hear that because you get great results with patients, which it sounds like you do, and we'll ask for some success stories later. But when you've changed the mind or the mindset of a practitioner that was burnt out, you could say potentially, that's so rewarding.
It is. Yeah. It is.
So from the business, like a treatment protocol, we'll talk about gut health. Would you assume would you say that that's foundational wellness? And how do you treat gut health conditions in your practice differently than maybe others do?
So I do think the gut is foundation. I mean, we know the gut-brain axis. We know that all autoimmune starts in the gut. Chronic conditions have a gut component that lifestyle can improve. And so when we look into the gut microbiome, obviously we'll do traditional labs. We do a lot of traditional labs, but looking into the microbiome is with one of the more functional medicine tests to get all the nuances of how you're digesting beneficial bacteria, opportunistic bacteria, looking at your short chain fatty acids and like, are you making your own GLP-1? Do you have leaky gut? Like there is such a thing. So getting into that and starting to heal that process of things, and then coupling it with other like lifestyle things. Like I spoke to a 23-year-old yesterday and I said, your ability to heal, a lot is going to align with what you're ready to give up in your life and what you're ready to add in. And so like we're equal partners here. I will guide you as much as I can, but you have to put the work in.
Yeah. That's very interesting because it's mindset it's willpower, it's commitment. All of those things are very important. You can lay out their roadmap to success, but they have to want to be willing to change and follow it.
Yeah, over the years, one of the things that I started asking patients when I start working with them is, do they believe they can heal? And
Mhm.
if they don't, I'm really hesitant to take them on as a patient, because your mindset, we know this in placebo trials of all meds, 30% of people get better if they think they're going to get better. So your mindset puts you there, and then we can do the work to get you there.
I love to hear that. Yeah. I won't bring up which family member, but if you ask that question of a family member, you probably wouldn't take them on as a patient. Because people just aren't, if they're not ready, why waste your time? That's a horrible way to say it, but you would rather see somebody in your practice that's willing to do the work to get themselves better, where you both get the reward for the person that's going to take your time. So unfortunately, let's talk about women's health. Hormone imbalances, women are a big focus for your practices. I kind of read up on that. So how do you evaluate and treat hormone health in your practice?
So we can do traditional ways. We can do blood draw and get the whole hormone panel, depending on if they're perimenopause, menopausal. Like, it depends on where I would do that. I also like the functional medicine dried urinary test or the wet urine test, even the salivary. Price point can be a thing for patients. The reason I do kind of tend to lean towards some of those functional tests is because we can get cortisol and the whole cortisol awakening and that diurnal curve, because stress has a lot to do with how you're going to heal. And I really think there is a lot of value in the metabolites that we can get through the urinary test that we have, like, to really know, do we need to help shunt somebody to a more protective estrogen? So there's a lot of nuances there that I feel are beneficial. But if a practitioner's just starting out, because I get quite a few that want to learn from me, I always start them with routine labs, because you have to learn the way we've been taught first to then go into the next nuance of things and understand that very well.
Yeah. So that raises a question for me. Like, you speak very, very much about your local community. Do you also see patients from a telemedicine standpoint?
We do. Yeah. I see patients from telemedicine. I'm licensed in multiple states, and we see patients from everywhere.
Okay, good. Well, I'm sure you'll get busier, as you said. That's a good thing. So a question now on supplementation. Some people, don't always like to discuss supplementation, but what did you feel the role for supplements and botanicals play in the protocols in your practice?
So they do play quite a part into it, but I always try to explain to patients, supplementing is actually to supplement what we're not doing in our life or our diet, right? Or if we uncover something in a test and we're like, this is what needs worked on. So, and I try to be realistic. Some things you're going to supplement for up to a year before we would go off of it. We might have to do it longer. But some things are going to be short-lived as the body heals, and their ability to get their mindset right and to be able to make those changes dietary, like trying to get somebody to eat 30 to 35 grams of fiber, is difficult. Even the people who do perfect things don't hit the higher marks of fiber. And so, we work on that. It's gradual. We don't go from eating 10 grams to 35, because then we make people feel miserable, but it's that gradual getting them to where they don't need supplements. So, and I always use myself and explain things at first, after my open heart, there were a lot of supplements I took until the inflammation went down. And now I scatter things in there to what I need. And I know when I need magnesium. My muscles feel achy and, I'm not sleeping well or something. And I say, then I'm hitting it back on my routine of supplementing and then working on the diet and the lifestyle. So,
yeah, that's good. So when patients do come in, I'm sure expectations are a very difficult thing to help them conquer. Some are willing to make the changes we discussed earlier, and some may not. So how do you help them with their expectations of if they'll get better?
So working with them on their why, we actually have an amazing practitioner who is so in minutes can get you to your why. There is nobody like her, but it's really working with the underlying reason. Why are you doing this? why should you invest in yourself? What does that mean? And helping them to see that and to identify that for themselves.
Yeah. So is that where you'll do some mindset work with each of your clients as well?
Yeah. So we have a practitioner that's very good at that. So
Okay.
it's not just me they're seeing, like we are a team and we work together very, very fluently to like optimize. So when I'm hearing something, I might be like, oh, hey, they should see Katie or they should see Becky because that would resonate with them more. And
Yeah.
that's kind of how we do it. Like, or maybe I'll have one of them join my call and be like, hey, you should join this call with me
Yeah.
because I think this person would really benefit from your input of this as well. So,
Okay. So specific conditions like you spoke about leaky gut and, maybe ulcerative colitis, is that still like that's the gut health condition, but then it goes gut to the brain connection as well?
right. So mental health diagnoses like anxiety, depression, like I often will treat the gut. If they have Hashimoto's, like those autoimmune disorders, there's always a gut component there that we need to be working on. So chronic things that people are coming in for, I usually will start with gut health as well, and then we work through that. When you think of your pillars of health, you really need sleep is so detrimental, your stress, hormones, and then gut. Like those three things need worked on before we start adding a ton of other stuff.
Okay. So it's difficult to treat people in many different ways. Do you do protocols from, our program is 3 months, 6 months, 9 months? I'm sure it's individually dependent, but do you have some protocols that you follow?
So it's very personalized, but we have put together some common, more protocols that would be helpful. We also have to take into consideration, one, finances for somebody. In addition to, some people don't do pills at all. Some people can't do powders at all. So we ask those questions because I can give you the best plan ever, but if you're not going to take any of that, it's not the best plan for you. So finding out that stuff, using maybe liquid liposomals, food as medicine is hugely important. So is movement. So really putting that in, we know those high inflammatory foods that we don't want to mention that people should rid of,
Yeah.
but really helping them to see why it would benefit them if they are that person. So.
Okay. Have you noticed in your area, and you've only been here for essentially a year, but have you noticed in general there is a higher demand for your services in your community and across the globe?
Absolutely. Yeah, definitely notice there's a higher demand for things. We're growing to where we're going to be in another community soon. It's very similar. When we get into the bigger cities, there's a lot more of this available. But when we get into rural and outlying cities in Ohio, or even, you think Indiana and Pennsylvania, like there's not a lot of providers that are doing this stuff. So that's why telemedicine comes in to play and works really well. But just by the outreach, I don't know if I told you, we had a launch party last week just to talk about our rebrand and everything, and hundreds of people showed up. Hundreds. From 10 a.m. until 6 p.m., like nobody sat. The first 4 hours, I didn't even sit down once. Like just standing, engaging, talking, and like the energy was so good, and it just made me know this is where we all need to be, and this is what we need to be on mission for.
That's so good to hear that. That's your why. I'm sure part of your why, maybe not your entire why, but when you make that much of an impact in a local community, it's a very rewarding situation.
Yeah.
From the business itself, where are you focusing? Like, what's your focus point on growth or scaling? Where are you at now?
So obviously we have all these practitioners and these different specialty areas that, we have somebody who's doing pediatrics now. We have somebody who's training for mental health, like integrative mental health. We've got somebody who's certified in weight loss, somebody who did their doctoral in SIBO, small intestinal bowel overgrowth. Wow. So we have an array of practitioners with very different niches and stuff. And so just marketing and getting out into the communities more. And then I would like to scale to where we have an online platform. I have an idea for this to where we can engage people that functional medicine or integrative might not be affordable for them, and finding a way to help them with this journey that can fit a budget. So,
Okay. Unfortunately, it's sad that the good foods are the expensive foods and the good care is out of pocket. From a practitioner standpoint, we would love for insurance to cover it because I'm sure you get that call every time. But then once insurance gets into this game, is it going to change it again? Are you going to be knocked down from an hour to a certain time? It's that give and take of you wanting to be able to help. But at what level? People have to understand it's the commitment, and sometimes it's financial commitment.
right, it is. And the way I try to explain it is if we took insurance, that would dictate what we would do for you.
Yeah.
Unfortunately, and I don't want to, I hate to say that to people, but that is a big piece to why we don't, because you're right, that time that we get to spend with people, that such valuable connections that we get, I would never get that in an insurance model.
Yeah. And I don't think patients understand that ratio of give and take from the financial perspective, the ability to sit there with you for 15 minutes, 30 minutes, 45 minutes and talk and actually let out their emotional pain from what they're experiencing to tell you. And then you're just allowed to listen and take much better care of them.
Right. I can connect with them. I love doing my appointments in person as much as I can, because even though virtual, you like see the person, you're doing that, but there is a connection to somebody when you're in the room with them.
Yeah.
And so I at least try to encourage people to come see us in person at least once.
Yeah.
So we get that piece of everything. Plus, you can read a patient's body language of how they're feeling about something. And I could better gauge if this is a plan that would work for them. And I can watch their facial expression and know that maybe I should tweak this some. Maybe they're not saying it, but maybe I should, based on what they're telling me otherwise.
Love to hear that. Can you share a success story of a patient of yours that's had great success in your practice?
Yes, I can. We actually have so many great success stories, but just thinking of, I worked with a nurse, and when I first seen her, she was on like 18 different medications, and most of them were for pain, chronic pain, things like that. And I was just like listening to her and working with her, and I was like, we should like dive into your gut. And so we did. And over the next, and it takes time, I want to point this out, it was an 18-month process, but I was able to get her deprescribed down to 3 meds, and she is not having pain. And I've seen her years later still doing amazing, doing well, went through menopause very well. But when I think of like the polypharmacy we were able to get her down from, some of those meds would have caused issues with her bone health later and all of that. So getting her to a place where she wasn't, and her big thing in her gut, like crazy, candida overgrowth was one of them, H. pylori, like just digging through the leaky gut and ridding of the infections. And that's a process in itself. But like to deprescribe somebody from 18 to 3 meds was, to me, that's a big success.
Yeah. Yeah. The pharmaceutical companies may not think so, but for the person, that's an amazing success. Yeah. And for you to see around the community and see the benefit of it, that's great too. So what would you say you have patient successes? How do you measure, like we talked about expectations, but how do you measure success with your patients? Tracking labs, overall quality of life changes?
Yeah, I definitely track labs. So that's a really important piece to this. But I also do the medical symptom questionnaire, which you might be familiar with. IFM has a great one that you can use. And I track that because sometimes when somebody starts to feel better just a little bit and things, they don't realize how improved they are. And then they still hyper focus on that one thing that's still there. So like this week, I had somebody that their medical symptom questionnaire score initially like a month ago was 39 and it's 7 now. And she was like, I knew I felt better, but I didn't realize how much better. And so it's exciting for them, for us to be like, hey, do you remember this? And then we'll talk about what's left. Yeah, we still have some work. We're still doing stuff, but like, look how far you've came.
Yeah.
And really, let them know like their commitment to this is the reason this is working. You are doing this. It is working for you.
Conduit of their care to get better. I mean, there's a lot that you should pat yourself on the back for, but they still have to do it. They still have to make that commitment like we talked about.
Exactly. It relies on them. It's a relationship that we have, but it really relies on the work they put in also.
Yeah. You gave me a little bit about vision and strategy, I guess, but what's the vision for Aspire Wellness and Integrative Health over the next 3 to 5 years?
Our vision is to expand outside of the state of Ohio and to have clinics more, through the United States and be a little more that way. Education, obviously, having some opportunities for people who can't truly afford functional medicine. We've even talked about, how can we do things for community? Is there a way for people who really need us that we could start to have a plan in place where we give back to some individuals yearly in that aspect, like treat somebody who could never be able to afford even the supplements or anything. So.
Yeah. That's good. You have to have that's a God-given gift of wanting to be able to help people when they can't. So that's ethics and integrity in a nutshell right there. So I commend you for that. I hope you're able to do that, and maybe you can find some investors to help you with along that too. So I want you to brag a little bit about yourself. What do you think either you or your practice does better than anyone else that's out there?
I think we listen better than anybody else. I really think that's key to it. Although we've got some star people on this team, and what I will tell you is they will meet you where you are on this health journey, and I think they do that better than anybody else. They're not telling you this is what you need to do. They're listening to where you are and saying the next step could be XYZ. You tell me where you're ready for it. They do a great job of that. So I think we got a star team.
Okay. And that helps. Doing it all on your shoulders is a difficult task. We're getting close to wrapping up here, and I'll share all of your contact information, website, social media contacts, all that. But what's the best way if someone has an interest in what you have to offer for them to get in touch with you?
So they could get on our aspirewih.com and book a discovery call. That's really good, or even call the office. But the discovery calls are time set apart where they have 15, 20 minutes to ask their questions and really get to know if we're a good fit for them. And they instantly will get the feel of our practice in that call.
Okay. Is there a place on your website, this just popped in my head, that people can find out what states you are licensed in, or would they set up that discovery call and learn from that?
They could learn from that point. There's like 27 states we can do stuff in. So,
all right. Well, that's pretty good. That's good coverage. Yeah. From an overall global health standpoint, if you could give one piece of advice that would affect everyone's health in a positive way, what advice would that be?
I would say look at your food as your medicine, how you nourish your body. Let it be for those reasons, not to just eat out of stress or eat out of emotion, but really to look at what am I putting in my mouth, and will it turn on or turn off disease? Yeah. That to me is so impactful.
Love it. All right. So the last question here, you are on the Prime Health podcast. So I ask this, what's the definition of Prime Health? It means something different to everybody, but for your perspective, what would you say is a Prime Health definition?
So I would say Prime Health is living less of our years with disease. So most of us live 20% of our life in some sort of chronic condition and disease. So Prime Health is not totally the absence, but less years like that. It's feeling energized, resilient, and really aligns with what an area of life that they are in. So
I love that. I've not heard that before. I'll be listening again so I get that, so I can impact that on myself even more. So thank you for sharing that. So Deidre, I really want to say thank you. I know that this has been a busy week for you after your big event last week. So taking time out for me is great. And our guests, we would always, both you and I would love for people to, share this because it will help grow our message. But as I said at the start, for you and I, it's not about much for you and I. It's really about the potential patient that's out there that could benefit from this. So if there's someone listening that was having coffee this morning or playing pickleball with a friend that's like, you know what, I've been having problems, I need to do something about it. You guys offer, discovery calls, and that's fantastic. So I would ask people that if you found benefit from this, which I know you did, please share it because it's important for other people to see this and learn more about it. So Of course, I'd love it if you'd subscribe to our podcast as well. But until next time, remember that this is a true wellness journey and we're all on it together. Whether you're taking charge of your own health or guiding others on theirs, every step forward matters. So I just ask that you stay committed to your Prime Health journey. And again, Deidre, thank you so very much for your time today.
You're welcome. Thank you for having me.